start the record. Over to you, Lucille.
Well, thank you very much, Martin. And thank you all for being here. I'm Lucille Beseler. I'm a registered dietitian, licensed nutritionist, as Martin said, and I have been talking to you in a series of webinars. So this time we're going to talk about heart health. And I think this is such an important topic, and I hope you enjoy that I'm actually going to be talking a little bit about what is a healthy heart. First, with all our webinars, we have to remember that we need to respect all our cultures and the foods we consume. And let's figure out how we could take those foods that are part of our culture and make that a part of our good health, not something that we don't embrace. So, again, we've done that with our previous webinars, and we will do that again today. So, let's start with the first slide. What is heart health? So, a little bit about heart health. It really means protecting the heart and blood vessels from disease. So, what kind of disease can we have from unhealthy blood vessels? You really probably know this. It's a heart attack. It could be a stroke. There's many things what could happen if your heart is not healthy. What are some of the things that make us have a healthy heart? Well, nutrition and what we eat is very important. We know that, and we'll talk more about that. Exercise. So I know a lot of people say they don't have enough time for exercise. They don't like to exercise. So I'll tell you, you don't get a free pass with me because every morning, as I told Martin, myself and my 90-year-old mother go to the gym. We have to make time for exercise to keep our heart healthy. We need to make sure we're getting enough sleep, important. And then stress. Stress is a tough one. It would be wonderful if we can figure out how we can easily take stress out of our lives. That is really takes a lot of work. The exercise helps a little bit though. And then smoking and drinking do affect your heart health. So let's talk a little bit about some of these things that affect our heart. So now everyone has heard what is cholesterol. So, what is cholesterol actually? Because you go to your doctor and they'll say to you, your cholesterol is high. And sometimes you have a really great doctor and they'll tell you exactly what cholesterol is. Other times you're kind of scratching your head and saying, well, what does it matter that my cholesterol is high? Cholesterol is a waxy substance and it's made by the liver. So, guess what? We need cholesterol to live. It is part of our cells, it's part of our hormones. But when we have too much cholesterol, it can build up in our arteries. And then think of our arteries like a tube and the cholesterol getting into that tube and clogging it up. It's called plaque when it builds up in your artery. You know what happens with plaque too? It prevents blood flow because it keeps narrowing that artery, kind of like, our pipes or our drain. If you're throwing stuff down the drain, it starts getting clogged. Sometimes pieces of plaque dislodge and that can cause a heart attack. The kind of cholesterol that is really harmful to our heart is LDL cholesterol. Now, I'm going to tell you something you'll never forget. It's kind of corny. I'm a little corny. So, LDL, it's thought of as bad cholesterol. Think of it as lousy cholesterol. LDL, lousy cholesterol. You'll know that's the bad cholesterol. That's what can clog your arteries. Then there's HDL. That's good cholesterol. Think of it as happy cholesterol. You won't forget that either. That helps to remove the bad cholesterol. And we have to have a balance to protect affect our heart. Now, there are some people who have genetically high cholesterol, meaning everyone in the family has high cholesterol. And there's a new LDL that has been identified as the LDL that can be very harmful and lead to heart disease. So this is what the American Heart Association is saying that our cholesterol levels need to be at. What I will tell you, the most important thing, know your numbers. People will talk to me all the time, friends at the gym, everyone, and they'll say, oh, my cholesterol's high. And I'll ask, well, how high is it? And they'll say, well, I don't really know. It's very important for you to know. Now, I will tell you, I think that we're changing these levels, and I think that the American Heart Association is actually looking for the total cholesterol to be under 175 milligrams. That would be the best. So we keep getting tighter and tighter, or the recommendations from the scientific advisory boards get stricter and stricter. Why? People will tell me all the time, why do they keep changing these things? Because it's science. Science is ever changing. So when we learn new things, what happens? We change the recommendations. So it's really important for you to know your numbers. Well, HDL, non-HDL cholesterol ideally should be less than 150 milligrams PDL. So additional problems, if you have, let's say you have high cholesterol or you have high LDL cholesterol and your HDL is not as high as it should be, that's a risk factor. But these are additional risk factors. So if you have diabetes, if you have another kind of heart disease, if you have carotid artery disease, if you have a history of stroke, then your goals have to be much lower and your LDL goals should be under 70 milligrams. What it also tells you is you need to be monitored more closely by your physician. You need to go for those appointments, those physical exams, and get your cholesterol tested. We really call it a lipid profile. Lipid meaning fat, and it gives you a whole profile, meaning the total cholesterol, the LDL, all these things, the HDL. And then there's another fat that circulates in our blood, and it's called triglycerides. And it's another fat. Is it good that this fat would be elevated? Not at all. It also contributes to heart disease, and it increases our risk for pancreatic disease, pancreatitis. Triglycerides are influenced by our diet, but mostly they are influenced by how much sugar is in our diet, like sugary drinks, how much alcohol is in our diet. So if we're drinking every day, something that definitely you need to address. Obviously, excess calories and inactivity. I think that's a running theme. I think that many of you have heard that before. So, you know what? I wanted to spend a little time, even though we're talking about nutrition and food, I thought it was really helpful for you to understand a little bit about the drugs that help lower cholesterol because many, many people are on drugs now. As a matter of fact, a lot of people are not very happy about drug therapy, but maybe because of their genetics, they can never get their cholesterol down lower, as low as it should be. So those drugs do help. The drugs are statins, and they lower LDL cholesterol, and they actually reduce your cardiovascular risk. So then there's another group of drugs. They're called PCSK9 inhibitors. And they're a newer class of cholesterol lowering medications. And they target significantly reducing the LDL. You might have seen commercials for these. Repatha is one that's very popular. But how they work, it's a protein that affects the liver's ability to remove the LDL cholesterol cholesterol from the blood. So blocking the PCSK9 helps the liver clear more of the LDL cholesterol. So those medications are prescribed. The statins are prescribed to many, many people who have high cholesterol that they cannot get it down with diet alone. But these other classes of cholesterol lowering medication are really looking at those people that have very high LDLs, which can cause really bad heart disease. So remember, even if you're on medication, because I know a lot of people think this way, oh, I'm taking medication, so I don't have to worry about my diet. Wrong. You still have to worry about your diet. So let's talk about how those risk factors really affect your heart. So diabetes significantly increases heart disease. And how does it do that? Well, good blood sugar control helps protect the blood vessels. Bad blood sugar, high blood sugars really prevent blood flow to the heart and other organs. So again, we've talked about in the past why blood sugar control, you know, um, having good blood glucose levels is very important. So blood pressure, high blood pressure. There's a lot of people who have high blood pressure. It could be genetic that you have a tendency to have high blood pressure because everybody in your family did. It could be your lifestyle. It could be your weight. It could be how much sodium you eat, salt. It could be how much processed food you eat. Those are all things that can affect your blood pressure. But how does high blood pressure affect the heart? It damages the blood vessels over time. So many people have no symptoms of high blood pressure. And high blood pressure just makes the heart work harder. We don't want that. If you have high blood pressure, please test your blood pressure. Please remember to take your blood pressure medicine. So, as I said before, what are some of the things that can cause that high blood pressure? Genetics, smoking and alcohol, lack of exercise, our weight goes too high, and too much sodium. We're getting too much sodium from all the processed foods we're eating. So when we make fresh food, when we rely on our cultural foods, a lot of times we're not getting that high amount of sodium. It's when we like those prepared foods, fast foods, processed foods. I understand we all eat them once in a while. But when our diet is very laden with them almost every day, then that's where we're going to have a problem with our blood pressure. So, what does smoking do? Because smoking does a lot of really bad things. It does. First, I didn't put it here. First thing it does affect is your gums and teeth. People who lose their teeth, a lot of times it's from smoking. It really cooks your gums. And just for an FYI, I didn't put it here. Vaping is no better. So don't stop smoking and think you're going to go to vaping, and that's okay because the vaping is very harmful for the cells of the lungs. So it damages the blood vessels. That's what smoking does. And obviously, it raises your blood pressure and inflammation. So we have an increased risk of heart attack and strokes. Alcohol. Too much alcohol can raise your blood pressure and your triglycerides. And, it adds a lot of calories. High triglycerides can increase your risk for pancreatitis, and then heavy drinking damages the liver and the heart. So, lack of exercise, as we said before, we got to get that blood moving. It improves the cholesterol, brings the cholesterol level down because it moves the blood through the arteries. It helps with your blood pressure. It's great for weight management and blood sugar control. So, exercise, find a way. If you live in the city, go for a walk, go window shopping. If you're somewhere where there's a gym, go to the gym. You don't have to be the most perfect person at the gym that you know every machine, but just go, get on the treadmill, get on the bicycle. Not only you're going to have a great time, you'll feel better. You'll meet some great people, I'm sure. So, what does heart healthy eating actually mean? Again, it's not focusing on perfection. I love that someone said, and I don't know who said it, don't let perfection be the enemy of progress. So some people say, oh, I can't do it perfect, or I didn't do well today. So now I'm going to, kind of trash my whole change in my dietary patterns. No, what we want is a stepwise approach to heart healthy. So think of plants, fiber, healthy fats to support heart health. So fiber-rich foods, whole grains, brown rice, lentils, legumes, many, many different kinds of grains that are high fiber. Then you're looking for healthy fats. What are some healthy fats? We'll talk about that. But the healthy fats, most of the time, are plant-based fats. Those are the healthier ones. And we can very easily bring our cultural foods into this. So modern nutrition research tells us the Mediterranean DASH diet eating patterns are still strongly supported as the best for improving heart. Now, I think, as I said in my previous uh, presentation, you don't have to be from the Mediterranean to adopt some of the great things that the Mediterranean diet or even the DASH diet incorporate to get to that heart health. So, number one, it is that plant forward eating patterns that's going to lower the risk of cardiovascular. So, maybe having one day a week being, like a meatless day. That's a great idea. So you're decreasing your amount of saturated fat or reducing those ultra processed foods. Very important. We need to get rid of those. So, what is the whole emphasis on the Mediterranean diet? Olive oil, it's a really good, healthy fat for you. If you don't like olive oil, how about something like avocado or avocados? That's also a very healthy fat. But if you do have a choice, you want to make it a healthy fat like olive oil because it's a monounsaturated fat, which does not raise our cholesterol. Fish. Now, I know if you don't come from a country or, a community that is by the water, fish might be hard for you. You've never had fish. And I always find fish is one of those things that people love it or hate it. If you can incorporate fatty fish into your diet, it is really great. It has rich omega-3 fatty acid. I always say the one to try to start if you can is salmon. That's a good one. And then, of course, vegetables, fruits, nuts, beans. We can all incorporate that into our diet while lowering those processed foods and fried foods. So, here are some of this is kind of like a really great, I think, visual of the Mediterranean diet. So you see the base of it. They use the pyramid as a good visual. So the base of it is vegetables and fruit. And then we move up, and that's where you see legumes, nuts, beans. Great. Less of the seafood. And of course, if you can get wild caught seafood, I come from Florida, so I could get fish a little bit easier than if you're in a landlocked state. And then you see at the top of that pyramid is less meat, less sweets and fats. So I think we can all take a little bit of this and incorporate bits and pieces of this into the ways we eat. So let's talk a little bit about the DASH diet. They're really very similar. You'll hear DASH diet, you'll hear Mediterranean diet. The DASH diet is designed to lower blood pressure, which in turns improves our heart health. So it's rich in vegetables, fruit, low-fat dairy, lean protein. Now, this whole low-fat dairy is a big controversy now. Some people are saying, some scientific individuals are saying eat full fat dairy, full fat milk and cheese. I think it's moderation. Remember, if you're having whole milk as opposed to 2% milk, not a big difference. But if you're putting heavy cream in your coffee, then that is a big difference. So I would say I would not use that saturated fat. And then again, that DASH diet is lower in sodium and added sugar. So the DASH diet, what does it stand for? Dietary approaches to stop hypertension. And that's really been promoted by the National Heart, Lung, and Blood Institute to stop hypertension. So that why? Stop hypertension, reduce risk of heart disease and strokes. So, how to lower triglycerides, because I mentioned the triglycerides before, and high triglycerides are not heart healthy. So, again, we reduce our intake of sugary beverages and sweets, limit the alcohol, increase exercise and physical activity, and then just choosing those healthier, lower fat foods and more fiber rich foods. And let me say something about fiber. Fiber is really underconsumed in the United States. We do not consume as much fiber as we should. So if you're a rice eater and you love rice, think about it. Are you eating more white rice as opposed to brown rice? I love pasta and I have a hard time eating wheat pasta. So I do really try because that's better. That's a high fiber. If you're talking about bread, bread again, whole grain breads as opposed to, quote, a white bread or just a plain French or Italian bread. It should be a multi-grain bread. So now there are people who have such high triglyceride levels that they actually have to be on prescription omega-3 medications. Now, omega-3 fatty acids are the good fats that are found in like fish, they're found in flaxseed meals. So there are places you can get this great omega-3 fatty acid, which is good for the brain, good for the heart. But some people need a prescriptive level because their triglycerides are so high. So there are some on the market now that are being used. So I thought that I would take a stab at introducing and talking about some of the African heritage foods and heart health. So I hope that I hit it on the head here and that you all have a lot of really good comments about that. So because every time we talk, we're talking about food. And Martin and I were talking before the presentation, and I always like to say, remember, food is what brings us all together. How we prepare it is our different cultures. So I was telling Martin of a great time I had yesterday. I do go to the gym every morning with my 90-year-old mother, and we have a little family now at the gym, and everybody is from a different place, and some from different countries. I live in South Florida. We're a really multi-ethnic community. So this couple who are of Colombian descent invited us for breakfast yesterday. So the whole group went breakfast. And we had this wonderful Colombian breakfast. The coffee was unbelievable, and the foods were really great. And as I looked around and I saw everyone enjoying these foods, and they were talking about their favorite foods, I was thinking, see how food just brings us together, uplifts us, makes us smile, and just bridges any gaps. So I have my orders that I have to prepare, Italian sauce and pasta and invite everyone over. That's going to be my meal. So we got to eat this great Colombian food. So my feeling is, remember, use your cultural foods to improve your health. You don't have to get rid of them. Nobody should ever say, "Oh, do you eat that? Well, you shouldn't be eating that." Some things we know are not the best. I know in my culture, there's some foods that are special occasion foods. You and I know those things. But on the whole, let's think about some of the foods that can support heart health. So, and I hope you enjoy my stories because I enjoy telling them. So, things like, again, we already said beans, millet, that's a whole grain, fish, lentils, sweet potatoes. So those foods are really high in fiber, so they're really great for your heart. So I have here some West African foods that are, again, very high in fiber. They're high in vegetables. They got some great um, fiber because of the legumes. And then they have a lower amount of saturated fat. It's more lean protein. So especially if you have things like fish stew, that's wonderful. That's rich in omega-3 fatty acids. Good source of protein. So maybe what we want to do, though, we want to use less oils, whatever oil you may use. If you use palm oil or maybe some other kind of oil, maybe you could use that a little bit less. If you're frying any of the items for your meals, maybe you could grill it or bake it and then add it to your whole, I'm going to say, your whole casserole. Or if you're adding salt, maybe you could watch how much salt you're adding to your food. So then I kind of came up with this traditional West African foods that can support heart health. So let's look at, let's break it down. Like fish stew, again, we said great omega-3 fatty acids, lean protein, something like okra soup. The fiber will help the cholesterol. Beans and peas, great sources of protein and great soluble fiber. What does the soluble fiber do? It sucks the cholesterol up and you excrete it out of your body. And then green leafy, great potassium, good for your blood pressure control, and great antioxidants, which makes the blood flow well. Use spices without excess salt. So some other things that in my investigation that I was seeing, some lentils and beans, and these whole grains are so wonderful. These are not polished grains. And you know what they do with rice? They take the rice, they take the fiber off the rice, they polish it, and then you have no fiber left. So think of these grains, if these are part of your, traditional meals, use them. They're wonderful. They're very high in fiber. Now, if we have diabetes, we know that these are carbohydrates, so we can't have 3 cups of it. We have to control the portion size. So because I live in South Florida, I cannot miss the Caribbean foods. So I wanted to add some of those things like callaloo and greens and black-eyed peas, sweet potatoes, all really great. So if you ever think, "Oh, I can't eat potatoes, my blood it's not good for my blood sugar." No, that's not true. Sweet potatoes are very high in fiber. They're great glycemic control. Now, maybe these portions, that's a beautiful plate. So it's a visual, it's a beautiful. So maybe it has to be a half a sweet potato. Maybe the black-eyed peas that are taking over for the protein, maybe they have to be a little bit smaller in terms of portion size. Okay, but healthy cooking methods. We all like to fry food sometimes, right? We all like a good French fry or fried fish or something fried. But let's really make our food preparation towards more baked, roast, grilled, steam, maybe even the air fryer. People really enjoy using the air fryer, and they get a really crunchy, good product. So use herbs and spices and try not to rely on the heavy sauces. So, what are the healthy fats versus the unhealthy fats? So, the healthy fats, as I said before, olive oil, avocado, nuts, fat from fish, and saturated fat. Those are the fats mostly that are solid at room temperature. A saturated fat is always solid at room temperature. So that's lard, that's butter, that's any fat from meats. When you're trimming that fat off the meats, that's saturated fat. It's solid at room temperature. And why is that not good? That contributes to your cholesterol, the LDL, and it contributes to increasing that plaque in the heart. So fiber, think of fiber as the rotor-rooter for the drain. I said before, when your drain gets clogged, you got to put a little kind of a little Drano or rotor-rooter, got to come and clean it out. Think of fiber that way. Or it's nature's broom. It actually helps to brush your GI tract, helps to hook up to that cholesterol and actually let you excrete some of that cholesterol. As it's doing that, it brings down your blood sugar. And it does that from the foods we're eating that has beans, vegetables, fruits, and whole grains. So, too much salt. I can't say this enough. I know you're going to say, Lucille, you said it a couple of times. But you know what? We don't realize how much sodium we get. The recommendation should be about 2,000 to maybe 2,500 milligrams a day. Um, and you know what the average person is getting? About 7 to 9,000 milligrams a day. Why? We're eating restaurant food. Restaurants do not make bland food. You're not going to come back to that restaurant, right? Packaged foods. Every time you buy a packaged food, flip it over, look at the sodium. And remember the number that I put out there. If you're buying something and one serving has 2,000 milligrams of sodium, what are you going to do for the rest of the day? And then foods have naturally containing sodium. Those are not the ones we worry about so much. It's the ones with the added sodium that we get very concerned about. So, how about some traditional spices? The good thing about spices, they come in all different colors. Remember, many of these spices actually help your heart, help your blood pressure. Why? Because they have compounds in them that reduce inflammation. And inflammation is what increases your risk for heart disease. So let me show you some of these wonderful, wonderful things and I just love these colors because again, all of these colors are bringing antioxidants, they're anti-inflammatory. People have heard of turmeric as an anti-inflammatory spice. So these are some of the wonderful spices that you could use that are anti-inflammatory, brings down your blood pressure, brings down your cholesterol. Herbs. I love cooking with herbs. So you'll always find chopped parsley in my refrigerator, of course, Italian parsley. You'll find rosemary, mint. Those herbs give us so many vitamins and antioxidants, really great for your lungs too. So if you're like me, you want to buy a big bunch of parsley, chop it up, keep it in your fridge so you have it that you can add to a lot of things so you can always, enrich your food, make it taste better, and enrich it with great antioxidants. So instead of using bouillon cubes, everybody loves those bouillon cubes. It gives it so much good flavor, but that good flavor comes with a lot of salt. So any of those seasoning packets, you open a box of something and it has a seasoning packet in it, see if you get rid of that seasoning packet or only use a little bit of it because that is not really, helping you at all. So I put together some, maybe some traditional African spices that, again, what is it doing? We showed it before, but things like garlic may support healthy cholesterol and reduce blood pressure. Ginger, it's an anti-inflammatory and it reduces triglyceride levels. Turmeric, it contains antioxidants that have a great anti-inflammatory property. Cinnamon, cinnamon may support cholesterol and blood sugar control. Cardamom, I love cardamom. It really helps with your blood pressure. Hot peppers. So if you can handle hot peppers, there's something in it called capsaicin, and it supports circulation. And then black pepper contains antioxidants. Hibiscus, if anybody drinks great hibiscus tea, it supports healthy blood pressure. And then cloves, which are rich in antioxidants. So these are really wonderful spices that many, many people use. And you should continue to use them. They're really good. Besides, they taste good, they're good for you. So, shopping for healthy food. I think I've said this before, so I'm going to say it again. Shop the outside of the supermarket. Always. Always have a list before you go. So you're not, and then always don't be hungry when you go. You'll buy anything and everything. And we want to reduce our intake of those processed foods. So shop the produce section first. Read labels for sodium, sugar, and saturated fat. And healthy eating can fit many, many budgets. I know people will tell me all the time, oh, but fruit and vegetables are expensive. Sometimes they can be, but if you look at the price of potato chips, that's very expensive. Although I think now there's a whole lot less people buying processed foods. They're trying to lower the prices, but don't be fooled by that, you know. So, and look, frozen vegetables are fine. You can use frozen vegetables. If you can't afford fresh frozen, use canned vegetables. You can use them, rinse them, and you'll lower the sodium. But not eating them are not good. So what should we really concentrate on instead of, not eating this demonizing this food, demonizing that food? Sometimes we have to eat what our budget allows, but we need to decrease the amount of our portions. We have to change how we prepare some things, not by the spices we use, but by how we actually prepare in terms of frying versus baking. And then always add those vegetables and whole grains where you can. Simple lifestyle habits. Move your body every day. I don't care if you're sitting at a desk like this, get up every half hour, walk around. Manage your stress as best you can. Avoid smoking. Keep your medical appointments and screening. Remember some of the tips I told you. Ask about your numbers. Write them down. Have them. Compare them every time you go to your doctor. So, your key takeaways: you don't have to give up your cultural foods to eat healthy. And then small, sustainable changes improve your heart health. Food should nourish health, culture, family. They should be a way to bridge the gap between people, to bring us all together, to enjoy each other, eat healthy foods. Good, healthy foods are good for the heart. Bringing us together is good for our spirit. So, thank you very much. I want to also remind you that there is a diabetes prevention program that's put out by Wholesome Village, Bethesda Nutrition and Wellness Solutions, which is part of Wholesome Village. So please take this information if you want to enroll in their diabetes prevention program. So thank you for having me. I really appreciate being able to speak with you. I hope you enjoyed today's presentation, and I hope you learned a lot and that you can bring some of these things into your home. Thank you.